New Zealand has been in lockdown for far too long and needs to be at level 1 now with a trans-Tasman bubble already operating, says Deputy Prime Minister Winston Peters. In a revealing interview on Newstalk ZB today, he appeared to take aim at some of the Labour-led government's decision-making around the lockdown, saying the enemy was no longer COVID-19 but the health and economic impacts caused by continuing restrictions under Level 2. Police Minister Stuart Nash has also admitted there has been disagreement in Cabinet. "We have agreed to disagree respectfully, because the one thing we don't want to do is move backwards," he told Newstalk ZB's Mike Hosking. "We are leading the world in opening up our country and our economy. We're leading the world." Nash says while America's death toll will reach 100,000 later today, New Zealand's economy will soon be one of the most open in the world. "We'd rather take a conservative approach and get this right, because the last thing we want to do move back into level 3, or heaven forbid level 4. We're taking a prudent approach." Peters acknowledged that the health experts and their evidence were important. But he felt the country had been too cautious for too long now. "You have to look at the percentages and say, are we 98, 99% safe? If we are, we've got to risk it and get going. Otherwise far more people would die from depression and concerns about their finances than from the pandemic," he said. "The enemy we've got now is not COVID-19, it's actually the inability to turn this economy around, as fast as possible." He said New Zealand should be at level 1 now and the trans-Tasman bubble, allowing New Zealanders and Australians to travel between each country without quarantining, should be operating now. The COVID-19 pandemic in Taiwan is part of the worldwide pandemic of coronavirus disease 2019, COVID-19, caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. Unlike in most other industrialized countries, the pandemic has had a much smaller impact in Taiwan, with a total of 7 deaths as of May 11, 2020. The number of active cases peaked on April 6 at 307 cases, the majority of which are imported. Amid Taiwan's success of preventing mass lockdown that could have devastated the economy, International Monetary Fund, IMF, forecasted Taiwan's 2020 annual gross domestic product, GDP, with a decline of 4%, lower than 6% average decline of most developed economies. 130 private analysts predict a contraction of just 1.2% of the GDP, while the government remains optimistic of a growth of 1.92%. On March 15, Prime Minister Jacinda Ardern said New Zealand would follow Taiwan's example in their strategy to fight the epidemic. Several news outlets in New Zealand have also mentioned what Taiwan has done to prevent the coronavirus. TVNZ1 also reported Taiwan in the Saturday 6 p.m. headline. The COVID-19 pandemic in Vietnam is part of the ongoing worldwide pandemic of coronavirus disease 2019, COVID-19. Caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. On January 23, 2020, the first known case of COVID-19 in Vietnam was reported. As of May 26, 2020, the country had 327 confirmed cases, 272 recoveries, and no deaths. More than 261,000 tests have been performed. Hanoi, as of May, is the most affected city with 114 confirmed cases. Vietnam is cited by global media as having one of the best organized epidemic control programs in the world, along with Taiwan and South Korea. Several figures have praised Vietnam's response, comparing it to the success in 2003 when Vietnam became the first country to be cleared of the SARS outbreak. Despite inferior economic and technological capacities, the country's response to the outbreak has received acclaim for its immediacy, effectiveness, and transparency, in contrast to the alleged cover-up in China, and the poor preparation in the United States and in European countries. Even in comparison to other commended examples like South Korea, Singapore, and Taiwan, Vietnam has experienced a much lower number of cases and no deaths, 124 due to its inability to conduct mass testing like South Korea. Vietnam implemented a strict 14-day quarantine policy and traced people exposed to the virus. Instead of relying on medicine and technology, the the Vietnamese state security apparatus has adopted a widespread of public surveillance system along with a public well-respected military force. Like most of the world's economy, Vietnam was hit hard by the outbreak because of the slowdown of private and national industries, the downturn of stock exchanges, and the lower number of incoming tourists. However, Vietnam is expected to be harmed less than China.